Some patients here in the south are being asked to wait twice as long for operations because of ongoing pressures on the NHS. At Bournemouth and Paul hospitals, the backlog of planned operations known as elective surgery has increased by 11% since the start of the pandemic. That's up from just over 11,000 to more than 12,000 patients waiting across the trust. As for urology, it's seen waiting times for operations increase the most, up 25% to almost 800. Our health correspondent Alastair Fee has more.
In the summer, Ian was diagnosed with prostate cancer. That was 18 weeks ago.
I felt confident that they'd caught it at early stages, but it's a bitter pill to swallow, I think, sometimes when they can catch it early enough and give you the diagnosis, and then all of a sudden it's halted by waiting lists.
He's used the time well, losing more than 4 stone. But even urgent care like his is affected by the pressures on the NHS.
You worry about the cancer spreading, you know. That's been my biggest concern. And I know it's not the consultant's fault. I know it's not the cancer nurse's fault, who are brilliant. They really are. But it is very, very frustrating.
We can give you that date for you to come in and have your procedure done.
Like elsewhere at the Royal Bournemouth Hospital, those waiting for care has never been greater.
I've obviously taken a lot of calls from the patients that have been waiting a long time, and they just need reassurances that they've not been forgotten, that the consultants are aware of them and that they remain on the waiting list.
My name is James Manners.
Yes.
I'm one of the consultant surgeons in the team here.
It's been approximately about a year that I've had to wait, but it's not been too bad because of the position we're in with the pandemic.
Because you would have been worried to come in because of the risk of infection?
Yes, because of COVID.
Geoff has come in today to have a faulty kidney removed. The operation will put an end to painful infections.
If we see COVID limit our activities again this winter, that number will rise and the pressure of balancing who gets to go and who doesn't get to go will be felt once more. If things remain comfortable, then the hope is we'll get back to our normal running, where we're offering people, cancer or not, a date for specialist kidney surgery within a few weeks.
We'll start the operation probably in around about an hour from now.
2 weeks since I first met Ian, and he's finally in to have his prostate removed.
In an absolutely ideal world, there wouldn't be delays in cancer treatment, but there have always been waiting times of some degree. Fortunately for prostate cancer, we don't think that waiting times of the kind of duration he's waited are likely to make a substantial difference to the outcome of his treatment. I do think that the weight he's lost has the potential to make a significant difference. So it's always, as in every decision that we ever make in medicine, it's a question of balancing risks, but perhaps the question of balancing risk has been thrown into particularly sharp relief because of the extra pressures of the pandemic.
These are just so difficult times, aren't they? It's still a pandemic, whether we like to admit that or not, and that's put so much stress on them. So I think they do a fabulous job, I really do. I want to be around for as long as I possibly can, you know, and hopefully this has given me the opportunity to do that.
This trust has so far not had to cancel any planned operations this season. But the numbers coming onto waiting lists increase every day, and the prospects of gaining further ground this winter are slim. The team is happy with how this operation went, and Ian is now recovering at home. Alastair Fee, BBC South Today.